It is?
Thou shalt not die thyself. That is the first commandment of nursing. Yes, it is hypokalemia. Think about the question. Electrolyte disturbances. What would you expect as a severe result of severe diarrhea? Hypokalemia. Low potassium, right? Because that's where it's coming out of. Just think, when we give Kxalate for hyperkalemia, because that's the drug of choice for hyperkalemia, right? Kxalate, what are we expecting to see? A bowel movement, because that's what happens. That's where the potassium is coming out of. That's correct. I low-key think you wanted to pick that answer. You just wasn't sure.
I did, but I was trying to, thinking too much into the question.
Mm-hmm. You are caring for a child who has a temperature of 104 degrees. The child suddenly begins to rhythmically convulse. What is the first thing you should do? Gently restrain the child's movement. Ensure the child's safety. Call the doctor. Administer an antipyretic medication as ordered.
Safety is from making the patient safe.
You want to ensure the child's safety? Final answer?
Yes.
That's correct. You are caring for a 76-year-old client who has had recent surgery. When you arrive to work at 7 a.m., you notice that the client is confused, and you learn that the client is now affected with an electrolyte imbalance. With which disorder is the client most likely affected? Hyperkalemia, delirium, dementia, or hypernatremia?
You said the patient is electrolytes are unbalanced?
Yep, the patient's electrolyte has an electrolyte imbalance. Okay, and they're confused. And they're affected with an electrolyte imbalance. And what disorder most likely affected this? Why is this occurring? Would it be hyperkalemia, delirium, dementia, or hypernatremia?
I want to say dementia.
You said dementia. That is incorrect.
Delirium.
Delirium. That is correct. So what? And let me tell you why. Now, you said delirium. First you said dementia. Okay? Now you said delirium. Let me tell you what the difference was. You arrived at 7 a.m. There was a change in condition. You noted that the client is now confused, and you learn that the client is now affected with an electrolyte imbalance. What disorder is this client most likely affected? Delirium. You know, delirium comes on as a all of a sudden type thing, right?
Right.
When dementia is more of like a long-term progressing thing going on. So that's the difference between delirium and dementia. Okay, delirium is an acute situation. That's correct.
And delirium can be treated, right?
Yes. Yeah.
Dementia cannot.
Right. We can treat it, but it's not really, it's more so we're just kind of like prolonging the process, slowing it down with the medication. All of the following are complications associated with alcohol abuse except for what? Wernicke's encephalopathy, gastritis, vitamin B toxicity, or thiamine deficiency.
And these are all related. If they want to know which one is related to
Which one is not associated with alcohol abuse? It says all of the following are complications associated with alcohol abuse except for this.
Can you repeat the answer?
Yes. Wernicke's encephalopathy, gastritis, vitamin B toxicity, or thiamine deficiency.
Gastritis.
So gastritis, final answer?
Yeah.
That's incorrect.
I really don't know.
Okay. It's vitamin B toxicity. Okay, you're not going to be toxic with vitamin B if you're drinking. Okay. Long-term alcohol abuse is associated with vitamin B deficiency, not toxicity. Okay. Another word for vitamin B or B1 would be thiamine, right? So you're going to be thiamine deficient. You can also be at risk for Wernicke's encephalopathy, which causes you to have confabulation. And gastritis and hepatitis, brain disorders, and cardiac disorders are also associated factors. Okay. Newly pregnant, healthy woman inquires with the LPN about her schedule for subsequent visits. The LPN instructs the patient that visits are typically when? Every month through 28 weeks, then every 2 weeks through 36 weeks, then weekly through delivery. Every month through 32 weeks, then every 2 weeks through 36 weeks, then weekly through delivery. Every month through 26 weeks, then every 2 weeks through 36 weeks, then weekly through delivery, or every month through 24 weeks, then every 2 weeks through 34 weeks, then weekly through delivery. So when do we go to the doctor? During pregnancy. What is our cycle?
We go every for the first 2 weeks, and then no, because 26 weeks is what? 6 months?
A little bit over 6 months.
A little bit over 6 months.
Mm-hmm. When do you start going every 2 weeks?
Your last trimester.
Okay. So when is that?
That is between 30 to 40 weeks.
Okay. So we go every month through when?
26 weeks.
28 weeks. Then
No,
every
month. Every month until 26 weeks, right?
to 28 weeks. Every month through 28 weeks. Yep. Then every 2 weeks through 36 weeks. Then weekly through delivery. Remember, your last trimester starts at your 7th month.
And that's when you.
That's about 28 weeks.
So there's no every 2 with you.
Yep, you're doing every month through 28 weeks, and then you're gonna go every 2 weeks through 36 weeks, and then that last month you're gonna go 36 weeks through delivery. That's that last final 4 weeks. Yep.
Okay.
You have not been immunized against Hep B. You stick your finger with a used syringe that was used on a known Hep B patient. What type of action will the employee health or infection control department most likely take as a result of this occupational exposure? Prophylactic active passive immunity, prophylactic artificial passive immunity, prophylactic active natural immunity, or prophylactic artificial natural immunity.
A.
Incorrect.
So artificial, what does that mean? Does that mean that it was non-intentional?
Well, no, the situation was non-intentional, but you have to think about what the situation is going. What are we doing in this situation? We want to give this medication. We want to give you a medication, right? So we know it's prophylactically, because we're not saying that you have Hep B, but do we want to give you something that's active?
No, because we don't even know if it's active.
There you go. So that eliminates your A and C right there. Now you got a 50-50. Are you going to have prophylactic artificial passive or prophylactic artificial natural?
D.
D? You sure?
No, because what is natural?
It's not is it natural?
No, it's B.
It's B. Yep. Prophylactic artificial passive immunity. Okay. The parents of a child with autism have developed a reward system for favorable behaviors in which the child is rewarded with a token for each chore he completes. The tokens can be exchanged for toys of his choice. This is an example of what? Biofeedback, operant conditioning, systematic desensitization, or aversion therapy.
Can you repeat the question and answer?
Yes. The parents of a child with autism have developed a reward system for favorable behaviors in which the child is rewarded with a token for each chore he completes. The tokens can be exchanged for toys of his choice. This is an example of what? Biofeedback, operant conditioning, systematic desensitization, or aversion therapy.
Okay, so they're not trying to distract them or anything.
Nope, it's not a distraction.
D is out.
You said which one is out, D?
D.
C, yep, C is out. Yep, C is out. We're going to throw that out, okay? What about aversion therapy? What is aversion therapy?
I don't know what aversion is.
Aversion therapy is like a punishment, so to speak. So if you're an alcoholic and I give you Antabuse, I'm going to tell you I'm going to give you Antabuse, and if you drink alcohol, you can have a possibility of death-related symptoms, okay? So that will be aversion therapy. So that's out, right? Because that's not what we're doing. We're rewarding him for doing something good. What's operant conditioning? You remember Pavlov's law with the dog?
Maslow's law?
Nope, Pavlov's. This is back in psych. Think back to psych when you learned about Pavlov's law. So you ring the bell and then the dog gets the food, that sort of thing. Remember that process?
Like rewarding.
You're rewarding them, right. So that would probably be around the way of operant conditioning, right? Okay, if you do this, I'm going to give you something. Okay, so that's operant conditioning. When shining a pen light in a patient's eye, the nurse expects the pupil to do what? Dilate, constrict, change color, or stay the same?
C and D is up.
C and D is out.
Constrict.
So it's either dilate or constrict.
It's dilate.
You want the eyes to dilate when we shine a light in the eye?
Dilate is when it shrinks, right?
Dilate is opening up. Remember, cervical dilation, you open up to have a baby.
Oh my God.
Yep.
Okay, right. So we want it to constrict.
Constrict, yep. And when the other eye, let's say we shine a light into the right eye and the left eye responds, what do we call that? What's the term for that? That's a consensual response.
Consensual response.
Right? It's a consensual response. That's good. That's a good thing.
Okay.
Yep. Here's a small case study for you. Deborah is the licensed practical nurse caring for a confused and disoriented elderly patient. She attempts to reorient the patient several times and has moved his room close to the nurse's station. After many failed attempts to protect his safety, she decides to place him in a posy vest restraint. She assesses him hourly throughout the night to ensure his safety has documented her rationale for applying the restraint. What part of Deborah's action is missing from the intervention? Attempting to administer an anxiolytic first before applying the restraint. Calling the patient's family to notify them that she was applying the restraint. Requesting the charge nurse to apply the physical restraint. Obtaining a physician's order for the restraint.
C.
Requesting the charge nurse to apply the physical restraint?
Yes.
Final answer?
Yes.
That's incorrect.
But you can't restrain the patient without the doctor's order.
That was D, and that's correct. You chose requesting the charge nurse to apply the physical restraint. We want to obtain an order first.
Oh, okay. I thought that's what that was.
Oh, yeah, D. Yep. You want to get an order first. That's right. Yep. You want that order. Your patient has been diagnosed with end-stage liver disease. He has few financial resources, no social support. His family is no longer part of his life, as the patient has been abusing alcohol for years. Signs that the patient may be having difficulty coping with his diagnosis might include what? Good appetite and ability to sleep soundly all night. Crying in appropriate situations. Ability to make rational, well thought out decisions. General irritability.
General irritability.
Final answer?
Yes.
That is correct. All of the following can help prevent back injury of the healthcare worker except for what? Maintaining eye contact with the patient. Ensuring both healthcare workers and patients wear good footwear while transferring or ambulating. Ensuring housekeepers clean both sides of the hallway at one time. Requesting additional help from co-workers for difficult transfers.
Okay, so
all of the following can help prevent back injury of the healthcare worker except for what?
eye contact.
Maintain eye contact? That's incorrect.
Okay, well, it has to be when it has to be cleaning the floors on both sides.
Ensuring housekeepers clean both sides of the hallway at one time? That is correct. That was your first choice, wasn't it?
Because then it didn't make sense. I was like, okay. But then I'm thinking like eye contact. But it would matter if eye contact depending on how the patient's sitting and how where you're standing.
Exactly. Risk factors for pneumonia include all of the following except for what? AIDS, steroid use, coronary artery disease, or advanced age.
Can you repeat the question?
Yes. Risk factors for pneumonia include all of the following except for what? AIDS, steroid use, coronary artery disease, advanced age.
Okay. So yes, you can get you can have AIDS, you can get pneumonia.
Okay. So we're going to rule that one out.
I'm gonna rule that one out.
Okay.